Hi, Dan. Thank you so much for meeting with me today. We are so excited to have you as part of the team. I've arranged this meeting to allow us to chat about Brett and talk about a procedure that you will implement with him. Does that sound good to you?
Yes, it does.
Great. First, I thought it might be helpful to learn a little bit more about Brett and his personality, his goals, and his support needs. So Brett is a 24-year-old adult diagnosed with autism spectrum disorder, and he communicates mainly using gestures and limited sign language. He enjoys dancing and listening to music, watching movies with his friends, and working at a local record shop. At this record shop, Brett works to replenish stock, including sorting through CDs, records, and other products. Although recently, Brett's motor stereotypy has been interfering with his ability to complete work tasks. Are you familiar with the term stereotypy?
No, I don't think so. What does it mean?
No problem. Stereotypy is a type of repetitive body movement or behavior that a person may engage in. Brett's stereotypy includes instances of putting his hand around his neck, hitting his torso with his hand, rocking his torso or body, rubbing his fingers together, covering his ears with his hands, knocking on, rubbing, or repeatedly dropping materials. Decreasing Brett's stereotypy became a goal once it started to impede daily responsibilities, including interfering with Brett's ability to complete work tasks independently. Does that clarify it for you?
Yes, it does. Thank you.
No problem at all. An assessment of challenging behavior called a functional analysis was conducted in order to determine why Brett engages in stereotypy. During this assessment of challenging behavior, the challenging behavior in this case was stereotypy, and it was monitored within contrived conditions that each provide one specific consequence for behavior. We look for elevated levels of challenging behavior in any one condition to conclude the likely reason why Brett engages in stereotypy. Once we know the why, we can implement an intervention that directly targets the reason why the challenging behavior occurs. So here is a graphical depiction of the functional analysis. These results indicate that Brett engages in stereotypy because the behavior is automatically reinforcing. In other words, Brett engages in stereotypy because some part of the action feels good. For example, he may like the way that the action looks, sounds, or feels. We know this because Brett engaged in stable levels of stereotypy across all conditions, with the highest level of stereotypy during the no interaction and the control condition. These conditions provide no consequence for stereotypy provided by other people. These data suggest that Brett engages in stereotypy regardless of other people's reactions to the behavior and likely is maintained by the good feeling that Brett gets when he engages in stereotypy. Does that make sense?
Absolutely, it does.
Awesome. I also wanted to mention that we have previously attempted reinforcement-based strategies to decrease Brett's stereotypy, but overall they have not been effective in competing with the level of reinforcement Brett gains from engaging in stereotypy. Recently, we have decided to attempt a positive practice overcorrection procedure, which is a punishment-based procedure in attempts to decrease Brett's stereotypy. I'm going to explain this procedure to you now. Please stop me for any clarification or if you have any questions at all. So positive practice overcorrection is a punishment procedure where an intervention is implemented upon any instance of the problem behavior, or in this case, stereotypy, in hopes to decrease the likelihood of stereotypy occurring in the future. Positive practice overcorrection involves physically guiding the individual to engage in appropriate alternative behavior to stereotypy. In Brett's case, when he engages in stereotypy, we will be prompting him to engage with an activity he is currently engaged in an appropriate way. The immediate goal of the intervention is that repeated exposure to this procedure will increase the appropriate engagement with the activity and decrease stereotypy when engaged with the activity. The long-term goal of this program is to decrease stereotypy across multiple activities incompatible with stereotypy. For example, performing his work tasks of sorting and putting back things and replenishing stock. Research has shown that this strategy has been effective in increasing appropriate engagement with materials and reducing stereotypy within both high preferred and low preferred activities. It also has been effective in decreasing stereotypy with adults diagnosed with developmental or intellectual disabilities. Specifically, the research shows that positive practice overcorrection is a functionally appropriate intervention for decreasing stereotypy maintained by automatic reinforcement, which is the case for Brett, as I explained before. Another assessment called a preference assessment was conducted by the team to identify the relative preference of activities for the use within this program. Each activity's ranking was based on both individual ranking within the preference assessment as well as the percentage of stereotypy that occurred in the presence of that activity. Based on the results, and the results are right here, the team identified one highly preferred and one low preferred activity. Highly preferred being sorting cutlery and low preferred being playing with puzzles. We have not yet implemented this program with Brett. For the past few weeks, we have been collecting data on Brett's stereotypy when engaged in high preferred and low preferred activities, or a baseline. This graph illustrates how often Brett was engaged in stereotopy with an activity without implementing any procedures to decrease stereotopy. This data allows us to see if an intervention made a difference in the frequency of Brett's stereotopy once it's implemented. We can see that currently there are high levels of stereotopy and low levels of engagement when completing an activity. Once the positive practice overcorrection procedure is implemented, it is hoped that stereotopy decreases and engagement slowly increases, which would indicate to us that the intervention is effective. Now let's move on to the practical part of the intervention. So in order to implement the positive practice overcorrection procedure, you will need to collect materials needed to engage in the activity. Instruct Brett, it's time to engage with the activity by stating something like, okay, Brett, it's time to do a puzzle, or something similar. You're going to start a timer for 5 minutes, and throughout the activity, you will remain within arm's reach of Brett and watch his engagement with the materials. If stereotopy occurs, you will instruct the participant to stop by saying stop in a neutral but assertive tone, and prompt Brett to engage in appropriate engagement with the materials for 30 seconds. You will use a graduated guidance to prompt engagement. If Brett continues to engage in stereotopy during the positive practice overcorrection procedure, you will use the least amount of physical guidance needed for Brett to engage with the item in the absence of stereotopy, and you will stop the procedure after 5 minutes has elapsed. I mentioned that the prompting procedure you will be using is called graduated guidance. This prompting procedure is where you provide immediate full physical prompting and then hover over the individual's hands while they complete the next part of the activity. Hovering allows for the opportunity for physical prompting to be implemented quickly as necessary. You will slowly decrease your proximity to the individual and fade out the prompts to increase independence. The goal of this prompting procedure is to provide immediate assistance when required, for example, when stereotopy occurs, but also allows for independence whenever possible. For the purposes of this intervention, we will only be targeting to decrease stereotopy in these specific tasks named within the program, for example, puzzles and sorting cutlery. So if you see Brett engaged in stereotopy within another activity throughout his day outside of this program, you will not use this strategy to prompt proper engagement. Instead, you will follow the protocol for stereotopy as outlined within Brett's PSP. I will arrange an additional meeting for us to practice and discuss the program further. If you have any questions or concerns, please do not hesitate to reach out to me. Thanks so much for meeting with me, Dan, and I hope you have a great rest of your day.
Thank you so much. I'm looking forward to it.